Hey everybody, I'm here with Sal from Oceanus. Today we're going to be talking about Shockwave Technology. You probably have heard about this, but it is making a massive impact, not only in people's lives, which is number one, but also in the revenue in many chiropractors' lives, which is a really, really great combination when you have high patient satisfaction, high clinical efficacy, and it can be a revenue generator. So we're going to dive into this and much more. Sal, thanks for coming on and chatting today.
No problem. Thank you.
Hey, it is my pleasure. For those docs out there who might be a little unfamiliar with Shockwave, I guess let's just start there. What is Shockwave? How would you describe it?
Basically, it's a shock wave. It generates a pulse, a wave pulse, into the tissue, and that penetrates in, dilates the blood vessels, oxygenates, promotes healing. The technology started, probably in the 1980s with lithotripsy to break up kidney stones. And since then, the technology has been refined and reduced to where it can be used for inflammation, pain, just soft tissue recovery. And then we've seen a major shift in the last decade where the technology has moved to what they call like a radial or electromagnetic shockwave and that brought the manufacturing and the cost of the device is way down. So in the last, 5 or so years, now these machines are affordable to put into a chiropractic's office or, any physician's office and do treatments there. And since they're affordable, now they're profitable. So you can provide these treatments, sell a series of treatments and, pay for your machine and, have a good revenue generator that is profitable and quickly profitable with a low cost of ownership. And that's new. That's relatively new compared to the other modalities that have been out there historically, like ultrasound therapy or laser therapy. So Shockwave's kind of the next one.
Yeah, this has been something that I have seen, really the research taking off. And a lot of that's on the back of a lot of the outcomes that patients are getting. And doctors are getting really great results with a wide variety of patients that we'll dive into in a moment. But something I'd love to dig deeper on is really that cost. There's a lot of docs, maybe they were looking at Shockwave 5-8 years ago, early adopters, and the price scared them away. There's plenty of docs out there listening as well that might have a unit, but maybe they spent a lot of money. I mean, in some cases, it could be upwards of $50,000. One of the things with PhysioPro that I noticed was that you guys have factory direct pricing, and this makes it really affordable for a doctor to bring this in and be profitable very quickly. Can you talk a little bit about your pricing model, factory direct, and really the advantages of affordability with PhysioPro?
Yeah, we decided that because, we saw that these machines, as we developed ours and with the others on the market, they're very easy to operate. They're not complicated. So they don't really require a lot of training and hands-on, and they're not like the big Shockwaves of the past that require installation and, complexities like that. So they're simple, much more basic devices now because the technology's come so far. So we can kind of cut out the middleman. A sales rep or a distributor doesn't necessarily have to go in and provide training and staff training. It can usually be done with it like this, a Zoom call or a phone call to get the physician up and running with the machine. So yeah, our machines start anywhere from $5,000. They go up to about $10,000 for something and with the same specification as a $20,000 or $30,000 machine. Because we're factory direct, there's no distributor, no sales rep. It's just us. We have a service center and a manufacturing plant, and we provide all the service, of course, and spare parts right here out of Florida. But that model has just been the best because our incentive was, we got to put this into the physician's office. They need to be able to turn a profit on it. And my goal was to have them be able to do that in less than 60 days. And some of them are doing it within 30 days. They have their machine paid off. And so everything is just pure profit for their machine. And we've had a lot of happy customer success stories. We have a lot of references from it too. So, and that's the affordability because I don't know, the price you charge per treatment changes depending on, what city you're in, kind of area you're in, or how many treatments you're selling. So, but on average, you can sell a treatment package for maybe $1,000 for 8 to 10 treatments and you get the patient keep coming back. They'll usually get an immediate result, some immediate pain relief after the first. And as you continue the therapy, the healing process really begins to take. And then, like you said, the efficacy is there. The clinical data is there on all kinds of things, like, anything soft tissue, trigger points, plantar fasciitis, tendinopathy. There's lots of data on that. So it's out there. So our core competency, our philosophy is, hey, let's get this so the average physician's office can afford these They don't have to spend $50,000 on something that's not going to make them any money.
I think that's a great way to go about it. And you touched upon something that I think is really important for a lot of docs listening and watching, which is the training. Sometimes we can bring in modalities into our practice, and it takes you years to become actually proficient with it, which is a really challenging in the operations of business. When we look at the training necessary and the learning curve with Shockwave, how would you describe that? It sounds like it's relatively short.
Very simple. I mean, if you're doing an ultrasound therapy, pretty much the same thing. You set your machine. We use ultrasound gel just like you would with an ultrasound. So this is the same as that, no different. And we have in our software on the device, there's actually pretty much like the user manual pops up for every treatment you want to do. If you want to do a knee or a shoulder, just click that. It'll give you options. Click it. It'll preset the machine for you, so staff could use it. It's very, very user-friendly. It kind of presets everything for you. Just hit start and just go. So I find that usually if we can get the doctor on the phone for half an hour, they've got the machine completely figured out. And if they do require training, some facilities have large staffs where they want every staff member trained. We can do that too. It's $180 an hour. But we can do that. We can travel there and get that done. We rarely do it though. Most people kind of figure it out on their own. So
yeah, that's great. When you can bring down the learning curve, that really gives the opportunity to implement faster, which I think is really important. And one of the components that you mentioned that I'd love to come back to is you mentioned the different areas of the body that can be helped with Shockwave. And one of the things that I noticed with PhysioPro is that you have some programmed protocols that make it really easy for a doctor to get started with some predefined protocols based upon a body region. Can you talk about that a little bit?
Yeah, they're all in there. I believe there's maybe 30 or more. There's plenty of them in there. So those are the therapy protocols that have the most clinical data behind them. So you're going to have trigger points. You're going to have upper and lower back. You can have around the joints, knees, elbows, tennis elbow, things like that. They're all in there. So when you turn the device on, a human body pops up and you just push the part of the body you want to work, and it'll give you, 3 or 4 options of what to do. And, there's, chronic or acute type treatments that one's a little stronger than the other, and select that. And then you just pretty much hit start, and it gives you, it tells you how to position the machine, how many pulses to give per treatment. It presets all that for you actually, and tells you which therapy head to use. There's 3 therapy heads, different sizes. So it really walks you through everything. And that was our goal, was to make this thing very user-friendly and take the complexity out of this device. So it's a high-end medical device, but it's also should be simple for everybody to use. But yeah, all those protocols are in there. Anything you can think of that's soft tissue related, joints and all that, it's in there.
The docs listening that maybe they're just learning about Shockwave. What are some of maybe the top 3 to 5 conditions or body regions that you see clients using PhysioPro getting great results with their patients?
I have seen is any tendinopathy, patellar tendinopathy, a lot there. Great results. Plantar fasciitis in the feet. We do a lot of sales to the podiatry market. They love them. Trigger points. Yeah, but anything, soft tissue, calcific tendinitis, things like that. And then, of course, just your general like sciatica, lower back pain, because you can put it right on those that muscle group back there and really loosen things up and do a deep penetration into the tissue. So
that is great. So for the docs listening that maybe have been exploring different Shockwave units, and I'm going to encourage everybody to really keep a keen eye out for PhysioPro, not only because of the pre-program that you discussed, which makes it super easy to implement, easy to understand training, and affordability. And maybe this is some of what you'll answer with, but for the docs out there that are shopping around, what are some of the unique selling benefits, or what are some of the unique benefits that PhysioPro brings to the table, and why should docs really take a look at PhysioPro?
Well, ours is electromagnetic, and it's an electromagnetic system, so it's very self-contained. Some Shockwaves are electrohydraulic; they have water, salt water in them. Some are pneumatic; they have air compressors. So from a service standpoint, ours is electromagnet, and that's kind of the future of Shockwave anyway. That's where it's all headed. You have, less moving parts, you're going to have less service issues. And of course, we do provide, 3-year warranty on everything, and we service everything here. But yeah, just that the cost of ownership, your service costs are going to be less. Another thing is the therapy, the hand pieces that you provide the therapy with on the patient. Those hand pieces, they have a lifespan to them. The industry standard is about 2 to 3 million pulses, which is usually 1 to 2 years of treatments for the average clinic. Ours goes to 4 million pulses. So ours is the leading, the long, we have the most longevity to our componentry. Our accessories last the longest out of anyone else in the market. And then as far as, how comparing to the competition, other devices, if you look at the detailed specifications on any machine, they're all about the same. They all kind of max out around 200 millijoules of power, 25 hertz frequency. They're all kind of the same in that regard for power and frequency. So, and when we discovered that, when we saw that, we said, okay, if you made this user friendly, low cost of ownership, easy to service, and then you'd have something to, so that's kind of become our competitive advantage there.
That's great. So for the docs out there listening and they're curious how they can implement this in their practice, I guess in short and basic language, how does it work and where can you use it most effectively?
So it works. It's an electromagnetic shockwave pulses, penetrates into the tissue. That promotes healing. It's a deeper penetration than ultrasound or laser therapy. So mainly, in all soft tissue areas of the body, but especially extremities and joints. So shoulders, elbows, knees, ankles, bottom of your feet. It's excellent for the joints because it'll reduce inflammation and create a motion and pain relief immediately right after the first treatment. And as you continue treating, you'll see much rapid improvement over multiple treatments in the area. So extremities, joints, hips, as well as your larger core muscle and soft tissue areas as well.
What are some of the differences? So a doc listening, maybe they have laser in their practice currently, and the patient doesn't feel anything with that. And often laser can take some time to see a result. With Shockwave, does the patient feel it, and do they typically feel relief pretty quickly?
Yes. So that's kind of one of the benefits. It is similar to doing a laser treatment where you're doing a multitude of treatments over a course of time, allowing some healing in between. But yeah, the shockwaves, they make a noise and you feel the pulse. First just feels like, something vibrating on your skin. But after maybe 15, 20 seconds, you start to feel kind of heat really almost deep in your tissue. And then the feeling kind of changes a little bit after that. And then, by say the third or fourth minute, you're actually getting some pain, like relief in the area. And then when the treatments are very short, they really only take, they're 5 minutes or 6 minutes, sometimes less. And by the end of it, you'll have kind of that immediate relief that lasts a good amount of time, even into the next day. And as you do more of that healing will progress. But yeah, so the patient does have does feel it, and it's not painful. It's actually a kind of a therapeutic feeling.
Thank you so much for watching this video on the Evidence-Based Chiropractor channel. If you don't want to miss a single thing, please subscribe to our YouTube channel so you can get notifications of every video we put out, and we put out new content each and every week. So be sure to subscribe today.